Hi everyone. In the previous video we discussed about sterilization by heat and filtration methods. Today we will see about radiation and disinfection methods. Radiations, there are actually two types of radiations that are used for sterilization purpose. So one is non-ionizing radiation and ionizing radiation. So what are non-ionizing radiations? Non-ionizing radiations are electromagnetic rays with long wavelength, and examples of these non-ionizing radiations are UV rays, ultraviolet rays and infrared rays. I think most of us, especially some 30 years back, we used to have this infrared rays at home, especially to treat for pain, muscle pain. We used to expose the area where we have pain with these rays, infrared rays, till we feel that hot temperature. And this was actually earlier included in dry heat method of sterilization. This infrared rays, actually it is a dry heat method of sterilization, but it is now classified under non-ionizing radiation category. And these are the two examples of non-ionizing radiations. One is UV rays, another one is infrared rays. And the main property of these rays is they actually absorb, large extently they are absorbed as heat, and infrared radiation, that's why it falls under dry heat method. So mainly these non-ionizing radiations are used for mass sterilization of pre-packed syringes and catheters. And UV rays, you might have noticed in the hospitals, especially in front of the operation theatres, the entryway, operation theatre entryway, the enclosed areas, you have always these UV rays. And also in operation theatres, the entryways, and in the laboratories. And in the microbiology laboratories, you might have observed the presence of these UV rays in the laminar airflow or in bacteriological hood. We have this. Always before you perform the work with infectious material, we switch on this UV light, we expose for 20 to 30 minutes, then we switch off. So one thing note, very important, when it is ultraviolet rays, when you are exposing these rays, no operator should be there. Hope you all know the reason is it is carcinogenic. So only before you use it, you have to sterilize the inoculation hood or laminar airflow with the UV rays. And even after you perform the work, especially with the infectious material, again you can expose the laminar airflow or bacteriological hood with UV rays. So mainly for these purposes, the non-ionizing radiations are very useful. So coming to ionizing radiations. Ionizing radiations examples are, you have X-rays, gamma rays and cosmic rays. Compared to even non-ionizing, ionizing radiations are highly penetrative, high penetrating power it has. And one important thing about this, a special property of this ionizing radiation is no appreciable temperature rise. Whereas in case of UV rays or infrared, see, supposing when you are walking on a hot sun, okay, why do you feel that heat? That heat is mainly due to the UV rays in the sunlight. Whereas the property of ionizing radiations, no appreciable increase in temperature. These rays, X-rays or gamma rays, you go take an X-ray, do you feel the heat? I don't think you will feel the heat when you are taking an X-ray. So these X-rays, gamma rays, cosmic rays, there is no appreciable increase in the temperature by these rays. But hence, still it can destroy the microorganisms. So how it destroys? It damages the DNA. DNA is very vital for any living cell. So it damages the DNA, impairs the DNA. That is why the microorganisms are destroyed or killed by this ionizing radiations. Hence this method, since there is no appreciable temperature rise, this method is actually referred as cold sterilization technique. Again, it is a very important question in examination point of view for a dental student or a medical student, and in NEET entrance also they ask this, which method is referred as cold sterilization. And what are the materials generally are sterilized by using this ionizing radiations? You can sterilize the sterile plastic syringes, catheters, grease fabrics as well as metal foils. All these can be sterilized by ionizing radiations. So now we'll pass on to the different topic, that is disinfection, which is as I already told you in the earlier video, it is actually a relative term. It is not an absolute term. Sterilization is an absolute term. Disinfection is a relative term. We are more bothered about eliminating the pathogens. Of course, spores sometimes is not possible. for certain disinfectants, and usually these disinfectants are applied mostly for inanimate objects. And I would like to introduce certain terms before going to the detail of these disinfection protocols. So terms like what are disinfectants, what are germicides, and what are antiseptics. Disinfectants are chemical solutions which are used for disinfecting inanimate objects. Inanimate refers to a non-living object, okay, a non-living thing. And germicides are chemicals that can be applied to both living as well as inanimate objects, and mainly here also the purpose is to eliminate the pathogens. Antiseptics are mainly formulated for application on the living tissue. So in fact, certain antiseptics, if you see, it will be a diluted disinfectant. If you dilute the disinfectant, it has a property of an antiseptic. So I think you can call back to the history of microbiology. The microbiology students or any medical students listening to this video, you can call back to your history where the first disinfectant was introduced by the father of antiseptic surgery, Joseph Lister. He introduced carbolic acid. So carbolic acid is actually a phenol compound actually. Phenol basically, how he used it in the history you might have studied, he diluted this phenol. So it is not irritant to the skin or any tissue. He diluted it and used it as an antiseptic. Wherever he performed the surgery, he used to paint the area of the skin with this particular carbolic acid. So antiseptics are actually formulated for application on the living tissue. So before going into the different types of disinfectants, let me first discuss the properties which an ideal disinfectant should possess. Only if it possesses these properties, you can claim that particular disinfectant to be a proper disinfectant, perfect disinfectant. So the most important point is it should possess a broad spectrum activity. So what do you mean by broad spectrum activity? Broad spectrum in the sense it should be able to destroy all the microorganisms including bacteria, viruses, protozoa, fungi, everything. For each and everything you can't use a different disinfectant. So a single disinfectant which you are using should possess a broad spectrum activity. It should be active in the presence of organic matter. So what do you mean by that? It should be active in the presence of organic matter. Say for example, you are working in a microbiology laboratory with the clinical specimens, you are culturing the clinical specimens. So the clinical specimens can be a pus material, or it can be a stool sample, or it can be a sputum sample. So the stool, the pus, sputum, all these are organic material. So this organic matter in the presence, these organic matter after you are using for inoculation, you can't throw it in the dustbin just like this, you have to disinfect it. So in the presence of these organic matter, the disinfectant should not be inactivated. So even in the presence of organic matter, it should be active. So that's another important property. And any disinfectant should be effective in acid or alkaline pH. Whether the media is alkaline or whether the media is acid, it should have the action. And it should have a very speedy action. See, today you are putting it in the disinfectant, it should not take many days to disinfect. Few hours, few minutes, the microorganism should be killed. The action should be very speedy, should be stable. So when you are storing it in the laboratory for a long period, it should not get inactivated, it should be stable. It should not be toxic, absorbed in the circulation. So supposing when you are working with these disinfectants, it happened to be absorbed by you. So it should not create any harm to the tissues, or it should not corrode the metals. When you are using any materials to disinfect, metal instruments which are used in the surgery or in the dental setting, when you are using these instruments, it should not corrode the metals. It should have a very high penetrating power, especially with respect to the pathogens. It should have a very high penetrating power. And when you are mixing the antiseptics or with another disinfectant, it should be compatible when you are mixing, very important. And very broadly active on living materials. When you are using an antiseptic, a diluted disinfectant, it should be active on the living materials. It should not interfere with healing, very important. You are applying any antiseptic on a wound or something, the healing process should not be hindered. It should not interfere with the healing, and it should not cause any local irritation or sensation. Okay, fine. If any disinfectant is possessing all the properties, fine, you can utilize it. The most important for us is it should be cheap and easily available. Of course, see all the earlier points it is fulfilling, but it's very pretty expensive and very difficult to use, very difficult to procure. then no point in having a disinfectant. So after possessing all these properties, it should also be cheap, readily available, very safe and easy to use. So only then, if it fulfills all these properties, as a particular chemical, you can label them as an ideal, a perfect disinfectant. But till now, we don't have even a single disinfectant possessing all the properties. Take for example, you say always formaldehyde is a gold standard one, but it destroys also the spores, everything fine, but it's highly toxic to the tissue. So we don't have even today a disinfectant fulfilling all the properties. So since a disinfectant does not fulfill all the properties, you have different chemicals and different classes of disinfectants which are utilized depending on our needs. So I would also like to emphasize, especially for dental student point of view, I want to emphasize this. The CDC Atlanta, Center for Disease Control Atlanta, they have classified the dental instruments into different categories. Like they have classified into critical, semi-critical and non-critical. So let me explain in detail what are all the disinfectants that will be used for sterilization of these instruments later at the end of my presentation. So certain other terms also I would like to introduce. One is sanitation. So sanitation is lowering of microbial counts to prevent transmission in a public setting, like restaurants and public restrooms. So you might have noticed when any politicians visit or any VIP visits on the roads, the white colored powder are sprayed, that is mainly the bleaching powder to lower the microbial counts to prevent transmission in a public setting. Or antisepsis, now coming to antisepsis, it is actually the reduction or inhibition of microbes found on a living tissue. And always you can categorize these disinfectants or aseptic antiseptic agents into two categories based on its mode of action. So you can categorize it as static agents or cidal agents. So what are static agents? So static agents are those which will arrest the multiplication of the microorganism, but it will not kill the microorganism. The viability will be there, but at the same time the multiplication is arrested. Whereas cidal agents are those which will completely, actually it will kill the microorganisms. The cidal agents will kill the microorganisms. So we'll now see the different types of disinfectants based on the chemical nature. We have different types. Number one is alcohols. Alcohols are excellent disinfectants, especially the most frequently used alcohols are ethanol, isopropyl alcohol. But these alcohols, they don't have any action on spores, and the concentration recommended is 60 to 90% in water, these alcohols. And where it is used, these alcohols are used in the disinfections of clinical thermometers and disinfection of the skin, especially when you want to draw blood on a patient or you want to give an injection on a patient. Before you draw blood or before you give injection, you apply the methanol, isn't it, spirit on the area of the skin. So it is mainly the alcohol, methyl alcohol, which is used for disinfecting the skin. The next group of disinfectants are aldehydest, and especially these alcohols, usually the mode of action is they denature the proteins. By denaturing the proteins, they destroy the microorganisms. Aldehydes also denature the proteins and they destroy the microorganisms. And you have the most important aldehydes are formaldehyde and glutaraldehyde, which are most frequently used. Formaldehyde is bactericidal, sporicidal, and lethal effects also on the viruses. It is how you say when you see sterilization, the gold standard, we always say autoclave is the gold standard one. So similarly, when you see the disinfectant, the gold standard, the best ones are the formaldehyde. Even though it is toxic, it is an excellent disinfectant. That is why it is used in preserving the anatomical specimens. They are completely sporicidal also. So the next one is glutaraldehyde, which is very effective against tubercle bacilli, fungi and viruses as well as spores. So uses of aldehydes, you have formaldehyde, which is very useful in preserving the anatomical specimens. In the anatomy lab, you might have seen all the tissue specimens are stored in the 10% formalin. And even biopsies, for biopsies we collect tissues from the patients. These tissues are actually placed in 10% formalin, where completely the decomposition of the tissues will not occur. Hope you all know the decomposition is mainly by the bacteria, microorganisms. So when you place it in formalin, no microorganisms can survive, so no decomposition occurs with the tissues. The tissue is intact. You can take the sections and observe the tissues directly on the microscope. So mainly formaldehyde is used to preserve anatomical specimens, also for preserving the biopsies. Especially with formalin, we use sodium tetraborate. And also this sodium tetraborate along with formalin is used also to sterilize the metal instruments. And another important application of this formaldehyde is especially the leather industries. Okay, they use this, they use the hide and skin of the animal for preparing their leather products. And you know, anthrax is one of the disease of these sheep and cattle, and especially when you remove the skin of these animals, the spores can be present on the skin, animal skin and hide. So before they process the skin, hair or wool or skin, what they do is they will disinfect these products. The skin, hair or wool is destroyed with formaldehyde. They disinfect it with formaldehyde. Completely the anthrax spores are killed when you use this formaldehyde. So these are the applications of formaldehyde. While glutaraldehyde, a little toxicity when compared to formaldehyde, it is little less, glutaraldehyde, but little expensive than formaldehyde, and it is used to treat this corrugated rubber anesthetic tubes, face masks, plastic endocardial tubes, metal instruments, especially your dental instruments. Dental instruments and equipments can be sterilized by glutaraldehyde, and also polythene tubing. All these can be sterilized by aldehydes. So move to the next group, the dyes. Especially there are two groups of dyes. You have aniline dyes and acridine dyes. The aniline dyes, examples for aniline dyes are brilliant green, malachite green and crystal green. The most important property of these aniline dyes, they don't have activity on the tubercle bacilli. Since they don't have activity on the tubercle bacilli, you might have studied in culture media, the microbiology students might have studied in culture media. This particular aniline dye is used in the preparation of a selective media for Mycobacterium tuberculosis, that is LJ medium, Lowenstein-Jensen medium. We add this malachite green into this media. The medium itself is colored green, and this media is actually prevents the growth of any normal flora that the patient's sputum or may contain. Okay, so or completely it will, any salivary microorganisms, if it is mixed up with the sputum and the patient is collecting sputum for the diagnosis, all these aerobic microorganisms will be destroyed when it is cultivated on LJ medium, because it contains malachite green. So these aniline dyes have that important property. They don't show any activity on tubercle bacilli, but they are very active against gram-positive bacteria. The next group is the acridine dyes. Acridine dyes are orange in color, and they are very effective against gram-positive than gram-negative acridine dyes. The important dyes are proflavin, euflavin, acreflavin, all these are important dyes. It is also similar almost to that of the aniline dyes. Next is halogens. You all know there are different types of halogens like iodine, bromine, chlorine. Bromine of course is never used in any of the disinfection protocol. The iodine and chlorine only is used. Iodine is used in the form of iodophores. In aqueous and alcoholic solution has been widely used. It is as a skin disinfectant. Next to your spirit, methyl alcohol, which is used as a skin disinfectant, iodine also is used as a skin disinfectant and actively bactericidal with moderate action on the spores. Chlorine and its compounds also is having an excellent effect. All of you know the drinking water supply, the metro water supply, always they use chlorine for preventing any contamination with the pathogens. And the swimming pools, water supplies, they use the chlorine in the form of hypochlorite. In the form of hypochlorite it is used. The next disinfectant is about phenols. The phenol actually has a very important note here I would like to mention. This is the first disinfectant to be discovered, and it is obtained by distillation of coal tar. Phenols are powerful microbicidal substances, and phenolic derivatives has been widely used as disinfectants for various purposes in hospitals, especially the restrooms, the bathrooms, everything will be cleaned with this phenol. Even the floor can be disinfected with the phenol. Example, Lysol and Cresol comes under this category. The next group is gases. Of course, so far whatever we saw the disinfectant category like alcohols or aldehydes or halogens, we are applying these things either on the floor or on the skin tissue. But in case of operation theatres where a surgery is performed, the environment itself should be sterile. The air should be sterile. So wherein comes your gaseous disinfectant, they are very helpful. You have ethylene oxide gas, which is colorless, highly penetrating gas it is. It is a very sweet ethereal smell, and it is also effective on all microorganisms, bacteria, fungi, viruses as well as spores. And mainly this ethylene oxide are used for sterilizing heart-lung machines, respirators, sutures, dental equipments, books, even clothing can be sterilized with ethylene oxide. Also to sterilize glass, metal, paper surfaces, plastics, oil, food, tobacco, all these are sterilized by ethylene oxide gas. The next one is formaldehyde gas. Formaldehyde, you can use it in liquid form that we saw earlier, and the same formaldehyde can be also used in a gaseous form. So when you boil the formalin, the formaldehyde gas is generated only either that way, or you can mix in a proper proportion of this formaldehyde with the potassium permanganate. After the chemical reaction, the gas formaldehyde is generated, and this gas is widely employed for fumigation of operation theatres and other rooms, sick wards, everything. So when I want to mention here two terms, one is concurrent disinfection and one is terminal disinfection. So what is concurrent and what is terminal? Terminal disinfectant, for an example I can tell you, supposing you think a patient, a TB patient is admitted in a ward, and you know the TB patient coughs, the microorganisms are let out in the environment, and when he wants to collect his sputum, it is collected in the kidney tray, and this kidney tray which contains the sputum cannot be left like that for a long time. So immediately a disinfectant, a hypochlorite, sodium hypochlorite can be poured onto the kidney tray. So that is concurrent disinfection. Then and there you disinfect it. Then what is terminal disinfection? Terminal disinfection, say the same TB patient has been discharged from the hospital. You can't give the same ward for any other patient. You have to now disinfect it completely, and then only the ward can be used by any other patient. So now you have to fumigate that particular room with formaldehyde gas. So that is terminal disinfection. Once for all you are disinfecting the whole area, it is terminal disinfection protocol. So it is an excellent method for fumigation of operation theatres with formaldehyde gas. The next one is beta propionolactone, which is used for the fumigation of operation theatre, and it is also used for action against many viruses. It's very effective against many viruses. It has a very rapid biocidal activity. The percentage that is used is 0.2%, whereas formaldehyde, aldehyde, it is 10 point is used. Here it is 0.2. Next is surface active agents and metallic salts. They also act as an excellent disinfecting agents. Mainly how they destroy the microorganisms, if you see, they create, they will reduce the surface tension of these microorganisms, which is will lead to the lysis of the cell wall of the bacteria or cell cytoplasmic membrane. That is how these microorganisms are destroyed. And you have different types of surface active agents. You have cations, anions, non-ionic and amphoteric substances. Among all these types, the cations are widely used ones, and especially one example I can refer here is quaternary ammonium compounds. Cations are widely used, and one is quaternary ammonium compounds. They are very highly bactericidal and very active against the gram-positive organisms, but they don't have any action on the spores or tubercle bacilli or viruses. So this is regarding the different types of disinfectants and different types of chemicals which are actually used or adopted as disinfectants. So far we discussed about that, and I would like to also discuss here about the classification of these disinfectants which we saw now. And the Center for Disease Control, this is pertaining to dental fraternity. The Center for Disease Control has actually classified the dental equipments into three categories. You have critical, semi-critical and non-critical. So what are the critical ones? The critical ones are actually the instruments which are capable of penetrating the soft tissue or bone, and they come in contact with the bloodstream. Examples of forceps, scalpels, bone chisels, scalers, surgical burrs. So these are the examples of the critical items. While semi-critical ones, they do not penetrate the soft tissue or bone, but they come in contact with the mucous membrane or non-intact skin. So definitely they come in contact with the saliva. So examples of these dental equipments are mirrors, reusable impression trays, amalgam condensers. All these are examples of dental equipments which do not penetrate the soft tissue. And you have non-critical ones. They will come into contact only with the intact skin, especially the external components of X-ray heads, blood pressure cuffs and pulse oximeters. So this is how the CDC has classified. And while the Environmental Protection Agency of US, they have categorized the disinfectants into 3 categories. That is high level disinfectant, intermediate level disinfectant and low level disinfectant. The high level disinfectant are always labeled as sterilant / disinfectant. Always it is labeled like that. Basically, these high level disinfectants, they can destroy about 6 log count of microorganisms in a shorter time. So that is why they are categorized as high level disinfectant, which is always labeled as sterilant disinfectant. Whereas intermediate level disinfectants are labeled as hospital disinfectant. They are labeled as hospital disinfectant, and also they are labeled for tuberculocidal. Examples for these intermediate levels: for high level, your formalin will come under high level, while intermediate level disinfectants, phenols, iodophores, chlorine containing compounds, all this will come under intermediate level disinfectants, the hypochlorites and all. So which is labeled for tuberculocidal, in the sense these cannot destroy the spores, but it can destroy the tuberculosis causing organism. The next category is low level disinfectant, which is always labeled as hospital disinfectant, not labeled for tuberculocidal, in the sense it cannot destroy the TB bacteria. Say example is quaternary ammonium compounds, but you can just think why then it is included as a low level when it is not able to destroy the Mycobacterium group of bacteria. But still these low levels like quaternary ammonium compounds, they have claims a pass potency test, especially possessing the antibacterial activity against the nosocomial pathogens. Hope you all know what is nosocomial. Nosocomial are hospital acquired infections which are due to certain bacteria. We refer them as nosocomial pathogens. Especially the most important ones are Pseudomonas aeruginosa, Staphylococcus aureus and Salmonella enterica. So this low level disinfectants has a potency against antibacterial efficacy against these organisms, these 3: Pseudomonas aeruginosa, Staphylococcus aureus and Salmonella enterica, and it is labeled as hospital disinfectant and not labeled for tuberculocidal. Examples are quaternary ammonium compounds. So we saw earlier, we discussed about the type of instruments, dental instruments, which were categorized by CDC, and the same CDC has also referred how we are to disinfect these types of instruments. So how do you process? How do you disinfect? The very important is the critical ones should be cleaned, the critical instrument should be cleaned, followed by sterilization. See, always in dental instruments, the cleaning is very important. Let me explain that after informing this process. The critical ones are cleaned, followed by sterilization. That is, you can either adopt a autoclave method or a hot air oven method. The semi-critical ones, which are do not penetrate the tissue, so those ones are also cleaned and followed by sterilization, depending on the type of instrument, whether it can withstand heat. Certain hand pieces do not withstand heat, so for them you need not go for that method. So those which can withstand heat, you can sterilize by a autoclave or hot air oven, heat tolerant ones. And it is really advisable for any dentist to procure the dental materials which are heat tolerable, because you can adopt a good sterilization protocol. Or else, if it is not heat tolerant, you have to use a high level disinfectant for the semi-critical ones after cleaning. For the non-critical ones, you have to clean it and you can use a low level disinfectant, because it is just going to have a contact only on the intact skin. So nothing to worry, and you can just treat it with low level disinfectant. So why this cleaning is very essential in dentistry? I think some books also may not give this. That is, main reason is presence of prions. The prions are usually present in these dental equipments, which are the ones which are capable of causing slow regenerative disease, especially the Creutzfeldt-Jakob disease CJD or Madco's disease is caused by these prions. They are proteinaceous material. Okay, these prions. And if you just see from in the descending order, the resistance of these pathogens to various disinfectants, prion stands on the first layer, actually highly resistant ones, prions. Then comes your bacterial spores, followed by mycobacteria, then non-lipid and small viruses, then comes your fungi, then your vegetative bacteria, and then your lipid or medium-sized viruses like herpes simplex virus, HIV virus. All these are lipid or medium-sized viruses. So to remove the prions can escape. This is another very, very important question which is asked in the NEET entrance or even in the university exam. Which particular microorganism can escape even autoclaving? That is prions. So what you have to do? So if you have to autoclave, you have to clean it. By cleaning, for that you also have a certain equipments for cleaning these instruments, or manually you can remove it. After wearing a glove, you can clean it. Any debris, anything should be completely removed, cleaned, washed, and then only the instrument should be sterilized. That's very important note for any dental setting. So with this we conclude this topic of disinfection. Just to recap the topic which we discussed now about the radiation, you have ionizing radiation and non-ionizing radiation. The non-ionizing radiation includes UV rays, and you had in ionizing radiation you had X-rays, gamma rays, and this gamma radiation only is used for sterilizing the disposable articles. Then we discussed about various disinfectants. Basically they are categorized based on the type of chemicals. You had alcohols, aldehydes, and you had we discussed about the acids, phenols, gaseous agents, surface active agents, dyes containing aniline and acridine dyes. So among all the disinfectants, the gold standard one is the formaldehyde, which even is capable of destroying the spores. Thank you.